So increasingly, we're seeing an emphasis on incorporating the patient voice as part of routine clinical care using patient-reported outcomes. PROs are patients' own reports of how they feel, function, live their lives, and survive. And PROs are a powerful way to amplify the patient voice as part of clinical care when you ask a patient to complete a questionnaire about how they're feeling and functioning and use that information to inform their treatment and outcomes. With this increasing emphasis on patient-reported outcomes, it's important to know what the steps are involved if you want to use PROs as part of clinical practice. Because you have to figure out what are your goals for implementing the PRO intervention as part of routine care, and then figuring out which patients you're going to ask to complete which questionnaires, at what frequency, using what mode of administration, and then on the back end, determining how you're going to report the results in a way so that patients and clinicians can understand what the scores mean and use the results as part of practice. But it's important to be able to do this because using PROs in clinical practice has been shown to have a number of benefits. So studies have consistently shown that asking patients to complete questionnaires about how they're doing and using that information to inform their care facilitates patient-clinician communication, such as prioritizing what is going to be discussed during the visit based on what is most relevant and pressing for a particular patient. Ideally, you then actually address these issues as part of their care, and this process is facilitated when the PROs are integrated with care pathways. And then we can see improvements in symptoms, functioning, quality of life, and satisfaction with care, as well as potential benefits and efficiencies, such as fewer emergency department visits. And some studies have even shown improved survival. But implementing PROs as part of clinical care is not easy. And so resources and tools have been developed over the past decade or so to help guide the process. And then just this week, a tool was released by the PROTEUS Consortium to provide a comprehensive, unified, synthesized guide of all the previously available foundational resources. It walks step by step through the process of PRO implementation so that institutions that want to use PROs as part of clinical care can decide how to best implement the system. Because we don't recommend just one right approach of doing things, but we offer a range of options with their relative advantages, disadvantages, and resource requirements so that institutions can figure out what fits best with their particular context. All of these resources are freely available on the PROTEUS website at theproteusconsortium.org.